Hello, my name is Mitchell Brooks. I am an anaesthetic fellow at Queen's Square. And along with consultant Dr. Yasmine Samaroo, we've completed an audit looking at fasting times in CT-guided biopsy patients. In terms of the scope of this issue, CT-guided biopsies are performed under general anaesthesia for diagnosis of pathologies such as discitis, other infectious collections, and malignancy. At Queen's Square, these are conducted on the Neurology list, which is a busy, dynamic list and typically has a full set daily of elective and emergency cases. And that's not taking into consideration additional emergency cases such as MTs and coilings of ruptured aneurysms, which can present with minimal notice. As a result of working in this department, we realized that a cohort of patients, the ones receiving CT-guided biopsies, were often getting delayed, and this was resulting in prolonged fasting and the associated issues with this. And we also noted that the CT-guided biopsy cohort is a typically frail comorbid demographic. As such, we completed an audit. We use Epic, which is our online documentation system, to perform a search looking at the interventional radiology status board to identify all patients receiving CT-guided biopsies within the past year. This was a time from April 2024 to 2025. From there, we searched the documentation and reviewed these to identify age, ASA, and comorbidities. We also looked at the time the case was booked, when it was initially planned for, and when it was finally completed. And then also went through patient notes to determine when they were initially started on nil by mouth or a sip to send protocol, and when the patients were documented to have fed due to a delay in the procedure or when the procedure was actually completed. In terms of audit results, we identified 30 cases overall during this timeframe. They had an average age of 57 years old, and they had over 50% had an ASA rating of 3. In terms of fasting times, it was documented fasting times from 2 a.m. until the case was cancelled or completed. On average, these patients had a fasting time of 22 hours, but this ranged from 6 to 56 hours. So if you can look on the graph on the right-hand side, note that 15 of these cases were completed on the appropriate day. However, some had significant delays. One, in fact, had a delay of up to 7 days post the initial booking. Only 40% of these patients had a sit to send protocol, which resulted in prolonged fasting and worsening hypovolemia and deleterious effects of fasting. In terms of following up from this audit, we're going to present this to our departments and aim to apply an intervention to prioritize these patients to minimize these delays and then complete a re-audit cycle.